The reason I'm asking is so many men, they go years with feeling all the signs and symptoms of low T, just like I did. I have had low testosterone ever since I was a teenager, but just really did not know what was actually wrong with my body. Feeling signs like low energy, low libido, erectile dysfunction out of nowhere, couldn't lose body fat, massive levels of brain fog. That's how I was feeling when I got diagnosed with low T. I had a total T of 219. And for me personally, TRT was a second lease on life, giving me my energy back, my drive, my motivation, my libido, my confidence, my consistency, losing body fat, gaining lean muscle. That's what it feels like to be properly optimized on testosterone. What does it do for you? Turns you into a better father, better husband, better boyfriend, whatever your situation is. I know personally for me, I got diagnosed with low T when I had just turned 21 years old. I got diagnosed and had got married the same year that I got diagnosed with low T. And for me personally, the low libido and the erectile dysfunction was crushing me, man. And I can say confidently now that within the first 6 months of being on TRT, those things were a thing of the past. The anxiety, the depression, the erectile dysfunction, the low libido, those things are gone completely. I'm now optimized at a 950 total testosterone level. I feel freaking phenomenal. My levels of energy, drive, motivation through the freaking roof. Shadow, welcome to the chat, man. Good to see you. THA, welcome in. DRM, welcome to the chat, man. Appreciate you, bro. We're talking TRT here on the live tonight, guys. Main question for you right there above my head, asking you, what are your symptoms of low testosterone? The reason I'm asking is so many men go years without having a blood test done. And unfortunately, your general practitioner, when you get your blood test done once a year, is not showing your testosterone levels. They're not showing your total T, your free T, your estrogen. So you never have an actually idea of where you stand at hormonally. And if you're feeling the signs and symptoms of low T, it's time to get a blood test done to actually verify where your levels are. Because what I can tell you is 83% of guys that have at least one or more symptoms of low testosterone typically end up showing below a 550 on a blood test, indicating that their bodies are already in that primary hypogonadal state where your body is shut down producing its own natural testosterone. And that's why you're feeling the signs and symptoms of low T that you actually are. Similar to my situation, I have what's called genetic hypogonadism. I've always had low testosterone ever since I was a teenager. So for me personally, my situation might be a little bit different than yours. A lot of different types of men experience different types of low testosterone. First one being age. You know, as men, after we turn 25 years old, our testosterone levels are dropping by 1 to 2% per year. So by the time we're in our 30s, 35, 40 years old, we're already seeing sub 550 levels of total testosterone. And that's when those multiple signs and symptoms of low T start to kick in. And I could say by far the number one symptom of low T that most guys feel is the low energy, the constant fatigue, no motivation, no drive, no energy when you wake up in the morning. That's how most guys feel when they cross below that 550 total T level. Low motivation, yawning 10 times a day after sleeping 8 hours. Jeez whiz. Can't grow muscle levels back, came back at a 180. Jeez whiz, man. So Dom, let's get you some freaking help, man. If you haven't already, brother, book a free consultation call. Calendar's right there in my bio. Let's get you on our calendar to get you some freaking help, man. And since you already have your blood work done, the process of getting started at Harley Meds on testosterone injections is very fast. It's only about 5 to 7 business days from initial consultation call to medication prescribed and delivered at your doorstep. We don't mess around with making you wait around for months like a general practitioner or endocrinologist do, because personally, I know what it feels like to have low testosterone, and the last thing you want to have happen is be sitting around for multiple months waiting to get a testosterone test done, waiting to get a prescription from the doctor. It becomes a problem, man. 47 for me, yes, it's total. Jeez Louise, at 27 years old. Ty, so I got to pin this comment, man. This is definitely, and I can tell you this honestly, man, that 47 is one of the lower ones we've ever seen. If this is true, if you have a 47 nanograms per deciliter total testosterone, Ty, we need to get you some help yesterday, brother. Yesterday. I was at a 219 when I first got started, man. I know I had every single sign and symptom of low T. I could only imagine what it feels like to be living at a 47 total testosterone level. Ty, book a free consultation call, man. The calendar's right there in my bio. Let's get you on our schedule so we can get you some freaking help, man. Like I was saying before, most guys feel their best around that 800 to 1200 total T level. They're crushing life on all aspects. Their energy levels are back, their drive, their motivation, losing body fat, gaining the muscles as well. Romero says, does everyone have to run an AI? No, most guys on TRT don't have to take an aromatase inhibitor or an estrogen blocker. Most guys on doctor-prescribed TRT doses stay between that 30 and 70 range. They feel perfectly fine, no negative symptoms of high estrogen or low estrogen. And I would even say the symptoms of low estrogen suck even more than high estrogen. The low estrogen symptoms are erectile dysfunction, very sore joints, no energy, no libido. You don't have a want for really anything as far as your energy goes. Low estrogen is terrible. And a lot of guys, unfortunately, get prescribed a estrogen blocker when they don't actually need one. This most common thing we see in the TRT space is doctors prescribing like freaking Skittles, man. It's true, man. I do HRT at my office. Just wanted to show others it's possible for a younger male. Absolutely, man. Absolutely. It's life-changing. It really is, man. I went from a total testosterone of 219 to now being a 950. And like I always say, it's transformed my life on multiple different aspects. It's not just the physical. Yes, I did lose over 80 pounds of body fat, put on 20 pounds of lean solid muscle. But as far as the true benefits of testosterone, just as far as feeling normal as a man, it's that energy, that drive, that motivation, that libido, man. Just restoring your body to back to how it should have been in your early 20s, man. That's what TRT is truly meant to do. It's not designed to put you into a range where your body is too high of testosterone, too high of estrogen, you're having side effects. That is not what testosterone replacement therapy is for. Testosterone replacement therapy for the men that actually need it is to restore your testosterone levels back to where they should be normally, to function optimally as a man. And if you're feeling multiple signs and symptoms of low T, we need to get you a blood test done to verify where your levels are so we can begin to kind of figure out what's going on there. How do you keep your body? How do you keep your blood count down? So, Adam, as far as hematocrit, hemoglobin, red blood cell count goes, most guys don't have any issues with that on TRT. About 10 to 15% of guys might have to give blood maybe once or twice per year. What I will say is the most common thing that we see is that if a guy comes into the clinic with higher levels of hematocrit, hemoglobin, red blood cell count, the first question we ask you is, were you hydrated when you got your blood test done? If you were not, you're automatically going to show higher levels of hematocrit, hemoglobin, and red blood cell count. You need to be drinking at least 64 ounces of water before getting that blood test done to show an accurate baseline level of your hematocrit, hemoglobin, red blood cell count. So hopefully that makes sense, because even if you're not on TRT, or your wife, your girlfriend, she can go in to get a blood test done. If she's dehydrated, anybody can show elevated levels of hematocrit, hemoglobin, red blood cell count. So it's a good idea just to get a baseline to see where your levels are within normal range. What is your normal range? Most guys feel their best around the 800 to 1200 total T. Unfortunately, in the US, we use a massive scale between a 200 testosterone level up to a 1000 testosterone level to be considered normal. Most guys, when they cross below a 550 total T level, they already have all the signs and symptoms of low testosterone: low energy, low libido, erectile dysfunction, you're not gaining muscle, you're not losing body fat, you have brain fog, anxiety, depression. Those are the most common symptoms. And if you're feeling any one of those symptoms, we need to get you a blood test done to verify where your levels are so we can get you on a protocol ASAP to get you feeling better. Because 83% of guys that show at least one or more signs and symptoms of low T are showing below that 550 total T level almost every single time. And 550 is a critical number to keep in mind, because as you cross below a 550, that's where your body's entering what's called a primary hypogonadal state, where your body has shut down its own testicular function, where you're no longer producing enough testosterone to support your body's functions. And that's why you see the signs and symptoms of low testosterone that you're feeling. Just had my blood test done recently was at 325. Dang, dude. That's similar to where I was at, man. Similar to where I was at. At a 325, most guys, they feel like trash, man. If I'm being honest, we're talking multiple signs and symptoms of low T. At least three. Biggest ones being low energy, no gains in the gym, lack of mental clarity, anxiety, depression. Those are all hand in hand, like some of the number one symptoms of low T that most guys feel when they cross below that 550. So for you being at a 325 there, man, we got to get you some help, brother. Book a free consultation call. Calendar's right there in my bio. Let's break down a protocol for you that would work well for your body to get you back to feeling good, man. You feel all of those? I did too, man. I was at a 219, so I was a little bit lower than where you were at, but it's still pretty comparable. As a man, once you cross below 550, really it's only the symptoms getting worse, if that makes any sense. You know, most guys below 550 feel multiple symptoms of low testosterone, but as you get lower with testosterone, the symptoms get worse. Like the same symptoms, but they get worse. Drive is great, so I had no clue. Yeah, I mean, a lot of guys live in that state of false normal, right? You don't experience the signs and symptoms to a range where you think is out of the normal for you. But when you get fully optimized on TRT and you look back to what it felt like to be at a low testosterone point, you never want to go back to having low T. It feels freaking phenomenal to be fully optimized, blood work being picture perfect, no negative side effects from testosterone replacement therapy. I've been on TRT for 6 years and 2 months now, and I can tell you personally that my life has changed on all aspects, man. And truly the best benefits of TRT is that energy, man. Waking up first thing in the morning, your feet hit the ground, you're off to the races. That level of energy sustains throughout the entire day. You're not crashing out 4:30, 5 o'clock in the afternoon like you used to. It feels really good, man. It definitely does. Thank you for tapping the screen too. Appreciate that, man. So how do I work with you or your company? So simple process, man. If you want to get started with us, you can book a free consultation call. The calendar is right there in my bio. On that consultation call, we'll collect that lab result that you already have. We'll send that over to my doctors to review. My doctors will give you a phone call, go over your blood work with you, and then come up with a personalized protocol on testosterone injections to get you feeling freaking phenomenal, man. I have a 32.8 total T and 178 ORS. Skiza, are you in the US, man? Typically, if we see like a 32, like a decimal point as far as free testosterone, it's typically not a USA measurement. Typically, a USA measurement with total testosterone, nanograms per deciliter, is a solid number. My estrogen is 178. Holy heck, dude. Yeah, definitely talk to your doctor about that ASAP, man, because a 178 total T is way above the reference range, man. Most guys with estrogen, they're feeling their best for like 30 to 70 estrogen level. If you get too much above 70, you might have some negative side effects. If you get too much below 30, you might have some negative side effects. So it's that sweet spot. And that's why at Hardly Meds, we do that continuing blood work for you guys for free at 3 months and every 6 months after that. The whole purpose of that is to make sure that you're staying fully optimized, that your blood work is staying picture perfect. I get all the side effects. Yeah, definitely talk with your doctor, man. Gotta get back dialed in, man. Gotta get back dialed in. Desiree, thank you for tapping the screen, man. Appreciate that. Now, for those of you guys just dropping my live here tonight, you can see the main question for you I have is right there above my head, asking what are your symptoms of low testosterone? Have you had a blood test done to verify where your levels are? If you haven't, let's get you one done, man. If you feel like you have low T, you probably do. At least 83% of guys that we see coming to the clinic with one or more symptoms of low T end up showing below that 550 level of total testosterone, indicating their body's in what's called a primary hypogonadal state, where your body is shut down, no longer producing enough natural testosterone. So we got to get you some freaking help, man. Book a free call. Calendar's right there in my bio. If you don't have your blood work done yet, we can send you a lab slip. If you do have your own blood work done, we can collect that result and get you rocking and rolling on a protocol. Feeling like trash after 8 or 9 hours of sleep has to do with low T or just tiredness. If you're getting a solid 8 to 9 hours of sleep, man, and you're still feeling tired in the morning, that's a massive sign of low testosterone, because as men, our energy levels are supposed to be their best in the morning. As a natural production of testosterone, our T levels are the highest between 6 a.m. and 9 a.m. in the morning if you're on a normal sleep schedule. If you're working nights, it's a little bit different. But between 6 a.m. and 9 a.m. in the morning, that's when our natural testosterone production is supposed to be at its highest point. Typically, that results in a fully pitched tent in the morning or your energy levels through the roof. That's why most guys that have low T don't have those type of things happen. And by far the first thing that you're going to feel getting on TRT as far as your symptom relief and also your benefits from TRT is that energy in the morning, noticing that morning wood. Feeling freaking phenomenal since the second your feet hit the floor in the morning after the freaking races, man. How do you feel about a anastrozole? Some guys need it, some guys don't. I would say there's probably only about a 10 to 15% of guys out there that need an estrogen blocker or an aromatase inhibitor to stay within range. Most guys on properly prescribed dosages of testosterone stay in that sweet spot, that 30 to 70. And that's why at Hardly Meds, we take that continuing blood work for you guys for free, making sure you're staying fully dialed in, you have no negative side effects, your testosterone's fully optimized, your estrogen's within range, your total T, or your total and your free T is both optimized as well. Thank you for tapping the screen too, man. Appreciate that. Do you recommend injecting the fat or the muscle? I personally do the muscle, man. Intramuscular injection, upper outer glute or ventral glutes, what I've been doing for the last 6 years and 2 months of being on TRT. That's what works great for me. I would say if you're below a 15% body fat, you'll probably have a better time doing an intramuscular injection, just because there's not a whole lot of body fat to inject into. If you're above a 15% body fat, a lot of guys get great results with a sub-Q injection. I just know personally when I do a subcutaneous injection, when I'm below 15% body fat, I end up with like a little bit of a painful lump and bump underneath my skin, which I really just don't love. So that's why I just do intramuscular, man. I started at 250 a week to go from 690 to 1100. Ended up testing it. Holy heck, dude. I need to correct the dose ASAP for sure, man. Yeah, everything at Hardly Meds, at least if you're working with Hardly Meds, we're going to be testing your blood to make sure that you're staying within range and making those adjustments for you on the fly. That's why injections, I think, really are the most effective form of TRT, and they're the most adjustable. If you're on like a pellet or like a testosterone gel or cream, you really can't change much on your protocol, especially with the pellets. Like once you have that pellet installed in your arm or your leg, that pellet is there for 3 to 6 months and you have to wait for it to absorb. Or if you want to adjust things, you have to have it surgically removed. That's why when I first got started on TRT, like theoretically, I thought the pellets were going to be freaking awesome, right? Like, okay, I just have to one pellet, put in my arm or my leg for 3 months, I'll be good. Unfortunately, for the large majority of guys on the pellets, they don't feel that great because the pellet is designed for a very specific body type. It's about 185 pounds. And if you're a couple pounds heavier, a couple pounds lighter than that, won't feel that great, man. Won't feel that great. Do you prescribe HCG as well? We do, man. It's one of our most popular protocols here at Hardly Meds is testosterone injections with HCG combined to maintain that fertility, that testicular size and function, and also the natural testosterone production. How much on average for cost? So economics, the full pricing breakdown, brother, is right there in my bio. I can't state the specific number on TikTok Live because I do have a policy against stating pricing for prescription medications. And a massive military plane flying above my head right now is pretty cool, man. I live by an air base, so I always love to check out the bombers flying by. It's freaking cool, man. 12 only? What you mean, Gravius? What do you mean, man? User 407, thank you for tapping the screen, bro. Appreciate that. Now, yeah, as far as the pricing goes, man, we have no hidden fees, fully transparent pricing here at Hardly Meds, no contracts, everything's month to month. If you guys are curious on the pricing breakdown, you want to get started with Hardly Meds, you can book a free consultation call with the calendar right there in my bio. And on that same link that you click on my bio, you'll see the full pricing breakdown. If you scroll down a little bit, it'll show you exactly what you pay per month and also everything that's included. Like I said, we have no hidden fees, transparent pricing, covers everything you need, your doctor visits, your injection supplies, the medication medication itself, all of your continuing blood work, the shipping to get everything to your door, and the doctor's prescription papers, man. Everything is included. We have no hidden fees at all. And we also do accept HSA and FSA, which we're one of the only clinics in the US that actually can do that. Now, I do get the question as far as insurance goes. Like, does insurance cover TRT through Harley Meds? We don't specifically partner with any big box insurance companies, but a lot of our patients are getting their TRT reimbursed through their own insurance companies, just because everything at Harley Meds is doctor prescribed with a doctor's note. So you can always submit that to your insurance company, have them pay you back for your TRT. We have a lot of patients that are able to do that. When I got my blood work, hematocrit was high. Is it because I don't drink on my fast or beforehand? Yes. If you're not drinking water before you get your blood test done, man, you're going to show elevated levels of hematocrit, hemoglobin, and red blood cell count almost every single time. And as we always talk about, at least 64 ounces of water before getting a blood test done. That's what I do. Making sure you're staying fully hydrated first thing in the morning when you get your blood test done. Fasting means fasting from anything with calories, not fasting from water. So make sure you're staying hydrated for sure, Cody. No problem, bro. Yeah, I mean, we do see this a lot with guys that are getting their blood test done, especially on Mondays. If you're out at the weekend, you're at the beach, at the pool, did a little bit of drinking, whatever it was, you may be very dehydrated when you go to get that blood test done Monday morning. So we always ask you, hey, did you drink at least 64 ounces of water before getting that blood test done? That's the first thing, man. That's the first thing. Jerry, thank you for tapping the screen, man. Appreciate that. Damien says, should I quit this? I personally don't drink, man. My dad was a pretty bad alcoholic, so I'm pretty turned off from all that stuff. So I personally don't. But on TRT, you can enjoy a drink here and there. It's not testosterone replacement therapy is not designed to put your body into a state where you start having like liver and kidney issues. Testosterone replacement therapy, when doctor prescribed, is only designed to put you back into an optimal healthy state as a man, like you had in your early 20s. It's not designed to put you into a range where you start having issues and side effects when it's properly prescribed. Of course, we see guys that are abusing testosterone, they're doing like bodybuilding, things like that. I couldn't speak on that. On my channel specifically, we talk about doctor prescribed TRT for men with low testosterone. Was pleased by the reasonable price. We try to save you guys as much money as possible, man. And we also do offer discounts for our veterans, our active duty military, our first responders as well. Months, man, I'm showing 1400 test score. What are y'all gonna tell me? At a 1400, it's a little bit elevated, man. It's not terribly up there. I mean, some guys can handle that level perfectly fine without any negative side effects, but it is a little bit elevated. I would say most guys feel their best between like an 800 to a 1200 total T, fully optimized, no negative side effects, blood work's picture perfect. Now, of course, at Harley Meds, we're gonna take an in-dive depth to all of your blood work. We're not just looking at the total T number. We're also looking at your free T, your estrogen, all your other health markers as well to make sure everything is staying fully balanced. What I will say is the whole point and purpose of TRT is to become fully optimized. If you're going to take testosterone replacement therapy and your doctor's only getting you like a 400, 500 T level, there's almost no point. I was 77 in estrogen. That's a little bit elevated. So your T is elevated and your estrogen is elevated. Okay, man. I mean, it's not a problem. It's a very simple solution to that problem. Typically, it's a small dosage adjustment, very small dosage adjustment to get you back within range with the total T and the estrogen as well. You'll talk to all of our doctors about that, man. Kevin, thank you for tapping the screen, man. Appreciate that. Mendy, welcome to the chat. Rodney, welcome to the chat. Guy, welcome into the chat. Good to see you guys here tonight. It's a beautiful Sunday evening, man. We're just chopping it up about testosterone replacement therapy. I've personally been on TRT for 6 years and 2 months. Completely transformed my entire life and went from a 219 total T level to now being a 950. So it's pretty impactful, man. It's pretty impactful. And I completely changed my physique as well. If you guys are looking at getting on TRT to help you lose some body fat and build muscle, it definitely freaking works. Get a jump start in that new year. I lost over 80 pounds of body fat, put on 20 pounds of lean solid muscle within a 6-month time period of being on TRT. And that completely changed my life and my confidence, man, because I was 100 pounds overweight when I first got started on TRT, man. What should a 20-year-old be around? I mean, as a man in general, you want to be above that 800 total T level. That's where most guys feel their best. Our minimum age for TRT at Harley Meds is 21 years old. So if you're having problems with low T, I would definitely say try to find a good endocrinologist or a urologist that can take a look at your hormones, see what's actually going on there, if they can get you optimized. Hopefully you just find a good one, man, because we see so many doctors out there, as far as their general health system goes, they don't want to help with testosterone levels. It's very frustrating. And we've seen this historically, man. If we look back just 20 years ago with the reference range of total testosterone, it used to be a 650 to a 1500. Nowadays, it's down from a 200 to a 1000. It's absolutely ridiculous. And I can honestly say in the next 5-10 years, we're probably going to be seeing our education system in the US teaching our doctors that a 0 testosterone level is perfectly fine for a man. Because if you're truly at a 200 testosterone level, you walk into your general practitioner, they tell you you're perfectly fine. Your testosterone levels are very similar to what a lot of females are walking around with. And it's just unacceptable, man. It's very frustrating. Like I said, man, it used to just be frustrating, but honestly now it's just sad that a lot of guys are going into the VA, they're going to a general practitioner, an endocrinologist to get some help, and they're just not getting help with TRT. It's very frustrating, man. Can women get on TRT? A lot of ladies do take TRT. We don't specifically specialize in the ladies quite yet. Right now we specialize in helping the guys out, optimizing their testosterone. Is it all out of pocket? We do have an out of pocket option. Our private pay option is less than a cup of coffee per day. If you have an HSA or FSA payment, we can use that to pay for your TRT, so you don't have to come out of pocket for it. As far as insurance goes, Harley Meds doesn't specifically partner with any big box insurance companies, but a lot of our patients are getting their TRT reimbursed through their own insurance companies, just because everything at Harley Meds is doctor prescribed with a doctor's note. So you just submit that information over to your insurance company, have them pay you back for your TRT per month. We have a lot of guys doing that. And I couldn't promise that's how your insurance company will work, because I don't know what your insurance company is or what your plan is, but for sure we do accept HSA, FSA, and our private pay options less than a cup of coffee per day, man. It's very affordable. How can I use my work insurance from work? So Garcia, if you're a patient at Harley Meds, man, I think you are, if I'm not incorrect. But yeah, all you need to do is call, text, or email into the business. We can send you out your medical necessity letter, so you can send out your insurance company, have them cover it for you, man. Yeah, not a problem, bro. Not a problem. Chad, thank you for tapping the screen, bro. Appreciate that. Tony, welcome in the chat. Now, for those of you guys that are just dropping in the live here tonight, we're talking about testosterone replacement therapy for men with low T. And one thing I forget to mention all the time is that if you are currently on testosterone replacement therapy through a different doctor, through a different clinic, and you wanted to get switched over to Harley Meds, that is something that we do for you guys for free. We don't charge any sort of a transfer fee. It takes about 3 minutes over a quick consultation call that you can book with a link right there in my bio. We'll hop on the phone with you, get everything transferred over to Harley Meds so we can get you back to feeling good. And what I can say is we have a lot of guys that come from other clinics for several different reasons. It could be a money issue. Maybe you're paying way too much money for TRT per month right now. Maybe you're not on a proper protocol. You're not being properly optimized. You still have the signs and symptoms of low T, but your doctor's not looking in depth into your blood work. They're not listening to you of how you actually feel. At Harley Meds, we take that holistic approach to TRT. So we're not just looking at the numbers. We're also asking, how are you feeling on your treatment? Do you still have the signs and symptoms of low T? Let's take a look in here and see what you need to get more optimized. Big JP's in the chat, bro. Good to see you, man. We're chopping it up here on this beautiful Sunday evening, man, talking about testosterone replacement therapy, answering any and all questions. For those of you guys just dropping in the chat, drop your age, drop your T level down below. Let's talk it down, man. My dog's barking at like a delivery man. I think I have an Amazon package coming in. My dog's adorable. Her name's Winnie. She's famous on TikTok too. She's pretty freaking cool. If you guys are curious, you can look up Winnie the Wiener Dog on TikTok. She's got like 300,000 followers. She crushes it on there. Jamie, thank you for tapping the screen, man. I appreciate that. Arva, welcome to the chat. B-Rock, welcome to the chat. Like I said, for those of you guys just dropping in, we're talking about testosterone replacement therapy here on the live today, answering any and all questions about testosterone. Ask me anything, man. I've been on TRT for 6 years and 2 months, and the whole reason I got started on social media was to tell my story. Because when I got started on TRT, there was nobody talking about this stuff. Nobody wanted to talk about TRT. It was still very taboo. So I got on social media to tell my story of how much TRT has changed my freaking life, going from a 219 total T level to a 950, changing all aspects of my life, getting rid of my symptoms, man, my anxiety, my depression, my erectile dysfunction, my low libido, restoring that energy level, that drive, that motivation. Now I'm able to build muscle and lose body fat, as opposed to when I had low T, I was 100 pounds overweight. I could not lose body fat. I was trying everything under the sun to lose body fat. It wasn't happening for me. When you have low testosterone, your metabolism is shut down, your protein synthesis is not operating very efficiently. So even if you are eating healthy, those nutrients are not being partitioned very well. So you end up kind of in a stagnant point. You're going to the gym, you're eating the correct way, maybe you're even adding in cardio, but you're not seeing the results. We see this happen a lot with the guys that have low testosterone. The first thing I would say, man, just get a blood test done. Establish where your levels are so we can get a baseline done to see where we're going, man. I'm on treatment, been for 5 weeks. How much are the refills for 10 cc bottles? So as far as when we send out your refills, man, you'll have roughly 1 to 2 shots left in your vial before your next shipment automatically arrives. We make sure you don't run out of medication. You'll receive that like that. If you're on 200 milligrams per week, let's say, and the vials that we send out have 2,000 milligrams total of testosterone. So that vial will last you about 10 weeks if you're on 200 milligrams per week. If you're on a different dosage, just do the math backwards. That will tell you how long that vial will last you before your next package automatically gets arrived. Jose says, 5 months in, I've been dealing with some ED for a few weeks. What can cause it? E2 is at 93. That's very high, man. That's very high. So if your estrogen is at 92, definitely get on the phone with one of our doctors. Let's break this down, see what's actually going on. What is causing this? Is it your dosage? Is it something with your sex hormone binding globulin, your aromatization? Like, what's actually going on there? The reason of why you have high estrogen, because most guys on properly prescribed dosages of testosterone, they don't need an estrogen blocker. They're staying in that sweet spot 30 to 70. There's about a 10 to 15% of guys on TRT that might need a very small dose of an aromatase inhibitor or an estrogen blocker. Most guys don't need one, but we do have those things on hand here at Harley Meds. If you're one of the guys that does convert from testosterone into estrogen, aromatizing at a faster rate, we do have those options for you, man. What are the low T symptoms? So Mark, I'll pin this comment. We'll kind of break it down here real quick for you. I'll kind of rip off the biggest signs and symptoms of low T. Number one's going to be that low energy, man, that constant fatigue going throughout the entire day. You're crashing out 4:30, 5 o'clock in the afternoon. You're sleeping 7, 8, 9 hours per night, but you're still waking up in the morning feeling like a zombie, all groggy and crap. You're relying upon caffeine to make it through a normal day. That's the biggest symptom of low T. Then we go into things like low energy, low libido, erectile dysfunction, brain fog, no mental clarity. You're not losing body fat. You're not building muscle. These are most of the symptoms of low T. Anxiety and depression do fall into that as well. Abby says, are these TRT shots intramuscular? I personally do intramuscular injection. You can do a subcutaneous injection, which is into belly fat. I personally don't like to do that because I'm pretty lean right now. So when I do a sub-Q injection, I notice I get a little bit of like a painful lump and bump underneath my skin. So I do intramuscular injection, upper outer glutes. Now, what are the symptoms of higher T? It'd be all the opposite of that, man. If you're feeling freaking phenomenal, you're on top of the world, your levels of energy, drive, motivation, libido, your mental clarity's on point. You step into the gym, you're losing body fat, you're gaining muscle, you feel freaking phenomenal. That's a pretty good indicator that you have a decent level of testosterone, because the guys that truly have low T, they feel it. They feel it. And the guys that unfortunately have tried everything naturally. You've tried the test boosters, you've tried the vitamins, you've tried going to the gym, optimizing your diet, optimizing your sleep routine, but you're still not seeing any sort of improvement. You still feel the exact same way. That's who truly needs testosterone replacement therapy. The guys that have had the signs and symptoms for years, they aren't getting any help. That's who needs TRT. They need some freaking help, man. Restoring your testosterone levels back in that normal optimal range. It's the whole point and purpose of TRT. But as I always say, man, I would encourage you, try everything you can naturally before turning to testosterone replacement therapy. Try some test boosters, try some vitamins, see if you get some improvement. If you don't, you may be entering what's called a primary hypogonadal state, where your testosterone production is shut down. Your own testicular function of your body has shut down. And at that point, you could try everything you want naturally. You're probably not going to see a whole lot of improvement. Unfortunately, it is a medical condition. Primary hypogonadism, if you guys are curious, you can look it up on Google. It's not a fun thing to deal with, man. I personally have what's called genetic primary hypogonadism. I've always had low testosterone ever since I was a teenager. So for me personally, this was a massive issue for me, man. I had no mental clarity in school, didn't do very well, couldn't focus. I was always overweight. I was 100 pounds overweight when I first got started on TRT, man. Our zinc, D3, and K2 magnesium helping tests, those are great ones, man. I personally take vitamin D3, zinc, magnesium, and fish oil. That's exactly what I take, man. I started TRT, felt good, but my face got super puffy even after I work out twice a day. So are you on doctor prescribed TRT, man? That would be my first question for you, Jaden. Was it prescribed by a doctor? Was it from a pharmacy? Was it a proper protocol? There's a lot of different variables there. Now, of course, if you're talking about like cycles, roids, gear, bodybuilding, that's a whole different situation, man. A lot of bad things can happen very quickly if you're not getting your blood work done, having your testosterone prescribed by an actual pharmacy. A lot of guys run into some problems there, and that's where like the hair loss, the gynecomastia, the anxiety, the roid rage, that's where stuff like that happens. And unfortunately, a lot of guys get the two confused. They get testosterone replacement therapy confused with like a cycle, roids and gear, things like that. Okay, it was doctor prescribed, Jaden, got you, man. Were you doing 2 injections per week? That's one of the biggest things that we see. A lot of guys get started on TRT, but their doctor's only giving them 1 injection per week, and they have side effects. And the reason for that is testosterone cypionate has an 8-day half-life. What that means is the testosterone that you're injecting is only at its strongest point the first 4 days of your injection. At the 5th day, your levels of testosterone start to drop, your symptoms start to come back, and you might even experience side effects like water retention, acne, mood disturbances. Minimum 2 injections per week is what we do here at Harley Meds with bioidentical testosterone cypionate, making sure that you feel your best you possibly can, the fastest you possibly can. It's mimicking what your body's already producing, so you feel freaking phenomenal. And I've been on TRT with bioidentical testosterone for 6 years now, man. I feel freaking phenomenal. No negative side effects. My blood work's picture perfect. Have my blood work done. I'm waiting on the provider from Harley Meds to get with me. Perfect, bro. Let's see what it's at, man. I'm excited for you, bro. I am excited for you. Hey, if there's any adjustments that we need to make for you, man, we'll make those on the fly. That's the great thing about testosterone injections. If you need a dosage adjustment or injection frequency adjustment, we can make those things on the fly. It's very simple and very fast to do, as opposed to something like a pellet where it's surgically implanted into your arm or into your leg, where you have to go in and get it surgically removed in order to change anything with your TRT routine. For me personally, that kind of spooks me out a little bit, because you don't know how you're going to respond to it. You know, with your injections, if you need a higher dosing, you need more injection frequency, you can change those things like literally on the week that you're having those type of things pop up. Prosper, thank you for tapping the screen, man. Appreciate that. Salvatore, welcome to the chat. Iron Will, thank you for tapping the screen, bro. Appreciate that. For those of you guys just dropping into my live here today, main question for you is right there above my head, asking you, what are your symptoms of low testosterone? Do you have low energy? Do you have a lower libido, erectile dysfunction, very little gains in the gym, lack of mental clarity, anxiety, depression? Those are the biggest ones that most guys feel. Testosterone level, the number is critical to keep in mind. And if you feel like you have low testosterone symptoms, you probably do. Let's get you a blood test done to verify where your levels are so we can establish a protocol to get you back to feeling optimized, man. Very simple process. First step, book a free consultation call with the calendar right there in my bio. On that consultation call, we'll send you a lab slip so you can go get your blood work done to see where your levels are. And if it comes back low, we're going to talk to you about a protocol that will get you back to feeling good. All right, guys, well, I do have to hop off this live. I appreciate all you guys for dropping the live, showing that love and support. For those of you guys that booked that free call here on this live tonight, we're excited to get you guys rocking and rolling on a TRT protocol this upcoming week. For those of you guys that are already patients here at Harley Meds, again, as I always say, sincerely appreciate each and every single one of you guys. We'll always continue to serve you at a high level. I'll catch you guys in the next one. Have a blessed rest of your night. See you later. 3, 2, 1.